I think running a couple of minutes ahead here. I don't know if Wade has been able to join us yet. Kathy, do you know?
He's here.
Oh, he's here.
Yes, I'm on, Jay.
Wade, it's so good to hear your voice. How are you doing?
I am fantastic this morning. Thank you so much. Happy New Year, all.
Well, and Happy New Year to you, Wade. Now, Wade, I know that you can fill time if I give it. Are you ready to step forward?
I am happy to take it.
All right, then I'm going to stop sharing, Wade, and you should be able to share your screen. And if I can just ask everybody to do a courtesy check to make sure you're on mute. And we are going to start recording. I want to make sure that you all have that information. And I just want to give a warm welcome and a deep thank you to Wade Norwood for taking his time today to talk about not just poverty, but poverty in Wayne County, and to help us understand ourselves better. Sometimes it's really helpful to have somebody else share with you, um, a little bit about what's going on in your own neighborhood and from a broader and from a regional perspective. And Wade is just a deeply committed public servant with a great heart and great passion. And we're just thrilled to have him here. Wade, thank you so much. And just again, for everyone's information, we are recording now, and just ask you to maintain Zoom discipline, if you will, and stay on mute for us. Thank you.
Thank you very much, Jay. That was a gracious introduction, and I appreciate the housekeeping because I just shooed family cat out of here since we're recording, so I don't contribute to a lack of Zoom discipline. Good morning, all. My name is Wade Norwood, and I am the CEO of Common Ground Health. And I am absolutely delighted to be here. I know we've been planning an opportunity for me to come and share with you all since the fall, but we have had a very eventful life since the fall. But I appreciate the opportunity to come in and share with you all. And I would invite you, if you have any comments or questions, feel free to pile them in the chat, and I'll ask Jay if he would be gracious enough to play moderator, and we will deal with questions as we go along, and then I'll try and wrap up with enough time for us to engage in conversation. But for those of you all who are unfamiliar with Common Ground Health, we are the regional health planning entity for the 9-county Finger Lakes region. We see it as our mission to bring focus to regional health issues through our research data analytics, through our community engagement, and by being engaged in collaborative partnerships for solutions design and innovation. And so I am very mission centric in being here today because my hope is that I will be sharing data that would help bring focus to your work and to the work of your various work groups. And I am here to celebrate the collaborative partnership that we enjoy with you all. And I have become a huge fan of Jay Roskup, and I am campaigning to become the president of his fan club. So I will dive into my presentation by sharing with you some of my favorite cartoons. If a picture is worth 1,000 words, then I'll try and share some powerful pictures and spare you having to listen to some of my words. This slide shows the 9-county Finger Lakes region, Lake Ontario to the north, Pennsylvania border to the south. And it attempts to show the socioeconomic status of the people who live in the region by depicting socioeconomic status by zip code. Socioeconomic status is a composite measure that the very, very smart people who work with me have crafted. And it's an attempt to try and capture the poverty rate of those who live within each zip code, the unemployment rate of the adults in the zip code, the type of occupation held by the adults in the labor force, as well as the poverty rate, the per capita income of those who live in the zip code, and the household composition. The composite measure tries to show by color how well or poorly the population fares across those measures. The darker the color, the less well off people are doing, the lower the socioeconomic status. Generally, the poorer people are. The lighter color depicts the opposite wealth. This is the moment where I, with you all, I would have the liberty of engaging in conversation and asking you to this is your Rorschach test. What do you see? And I will tell you, I've been giving this presentation for almost 15 years now. And the things that people always respond, the things that jump out to even the least informed audience, are, first of all, that the pockets of poverty, the deep blue, is not relegated to the city of Rochester, which is that cross-shaped figure display in the upper left-hand corner. That it is very stunning for most people in our region to really understand the face of poverty does not look like Wade Norwood. The face of poverty in the Finger Lakes looks like all of us. It is striking to people to really see depicted clearly how broad the swath of poverty is. That quite honestly, the folks who are living in those two higher sectors, the SES 4 and 5, really are the exception geographically in this region. It should be noted, and it is often noted, how incredibly highly defined the pockets of wealth are here in the region. And for the purposes of our conversation today, people are thunderstruck and always ask, what's going on in the upper right corner? The truth of Wayne County is something that you all well appreciate, but is really not understood widely by your neighbors here in the Finger Lakes. The second map is the very same depiction, the Finger Lakes region by zip code. But this time the color coding doesn't aim to depict what's going on with socioeconomics. This time the color coding aims to reflect years of potential life lost, which is my favorite health measure. Because years of potential life lost is a calculation of how much premature death occurs within a population. It's based on a life expectancy of age 75 and lets us know within a community how earlier than 75 are we experiencing death. And to me, that is a powerful measure because it allows us to really understand what is the impact of health within a community. Since Jay gave me a couple of extra minutes, I'll take the time and I'll just spend a little bit of time talking about YPLL because it tells us things that the mortality rate doesn't let us see. It allows us to understand, and I often talk about my family at this point. My grandmother, my dad's mom, my dad, and my cousin Reggie all wound up dying from diseases associated with the metabolic syndrome. Diabetes runs very wide and has a long history in my dad's family. So it's no surprise that on my dad's side, relatives die of kidney disease, as did Reggie, of stroke, as did my nan, and or of heart disease, as did my dad. Oftentimes on that side of the family, people die as amputees. My Aunt Becky was a double amputee. Or they die blind, as did my dad's Uncle Ben. But there is a profound difference between my nan dying at age 93 in 2004. My dad dying at age 63 in 2003. And my cousin Reggie dying at age 39 in 2001. Profound difference. My nan got to see not only her grandchildren reach adulthood, but she got to see some of her great-grandchildren reach adulthood. My dad only got to see one grandchild graduate from high school. And most of the other grandchildren only have vague memories of him. My cousin Reggie never got to see his son Jonathan enter kindergarten. Same disease state, but very different deaths, very different impacts on a community. And so as we look at this map showing years of potential life lost by geography, what it allows us to see is the incredible impact of premature death within this region. You all probably have phenomenal, moving stories that you can tell about what premature death means in the eastern portions of Wayne County. What I can tell you is that there is profound reason for us to be very concerned about the similarity between these two maps, because they document everything that we need to understand about the social determinants of health. Because we know that 80% of what explains health outcomes is not biology or connectivity with the medical system, but it is social circumstance, it is the environment, and it's individual behavior. And I would submit to you that individual behavior does not only display the choices that people make, sometimes it's a reflection of the choices that people have. And if we look, and I don't mean to show this chart in a way of trying to minimize the impact of opioid and of cancer and of homicide and suicide. Those are all very important health issues that rightly galvanize and command our attention and our action. But what I do mean to say is that the fact that you all are spending today delving into the issue of poverty is absolutely important, is absolutely necessary, and is a sign of your collective wisdom. Because if we really analyze, which we've done, years of potential life lost and look at socioeconomics, what we find is that the difference between those highest levels of our neighbors on the socioeconomic ladder and those at the lowest level account for the greatest differential in terms of years of life lost. Quite literally, my friends, poverty is killing us. We at Common Ground Health have a very long tradition, formerly doing business as the Finger Lakes Health Systems Agency. We have a very long tradition of creating research and providing data and analytic to really talk about what's going on in our region. And we absolutely have lots of data that can substantiate this health difference between the highest and the lowest SES populations. But what we've been aiming to do since 2017 is really move our work beyond answering the question, what's going on, to really trying to ask and surface the why behind the what's going on. And one of the rules that Don Berwick promulgated around health improvement is that when you are in doubt, Berwick says, go consult the experts. And we found that there are no greater experts in terms of getting to the why than the people who live in the Finger Lakes region themselves. And so we spent 2017 designing a regional health survey where we would take this question to the people and ask the people who live in the Finger Lakes region to help us understand not only what's going on, but why is it happening? And I will tell you, my audacious goal for this was that we would get 2,500 responses. And we knew that the only way we would be able to get 2,500 responses from across the Finger Lakes region was to not only consult with the community, but to partner with the community. And I want to publicly acknowledge the incredible role that Diane Devlin and her leadership played in really helping us become partners with you all. I am incredibly grateful for the fact that the county health departments took this survey as their own. We started with this being a common ground health survey. We ended with it being a regional health survey because the input that you all through Diane provided completely changed the survey instrument. We delayed our work for 6 months so that we could get your expertise. We started off with 3 open-ended questions. We wound up with 12 open-ended questions, many of which were county-specific questions that we asked people. But in return, instead of getting 2,500 responses, we wound up getting 6,855 responses with the appropriate oversampling by race and ethnicity, by income and age, so that we can cross-tab to a fairly well. We were not able to get enough responses that we could cross-tab county specifically, but we can cross-tab but urban versus rural. And so I am very delighted to be able to share some of that data with you. But what I will say before I dive into that is that the greatest takeaway that I have from the voices of those 6,855 neighbors of ours is the incredible value and importance of mental health. It rings loudly through this. And because of the fact that we wound up getting 12 open-ended answers from almost 7,000 folks, it gave us a lot of people talking in their own words to help us understand the health of our region. And I really cannot overstate how important it is for us to understand that when folks talk to us about mental health, they did not talk about bipolar depression or schizophrenia. They talked to us about helplessness, about what it's like to live constantly having too much month and not enough money. They talk to us about anger, that feeling that you get when you're sick and tired of being sick and tired. And they talk to us about self-destructive behavior. and self-destructive behavior is a precursor to destructive behavior. And it's been very interesting to have and to mull over and to talk about this data, which we captured in the summer of 2018, during the course of 2019 and 2020. Because the events in our world, in our nation, and in the Finger Lakes, with this data and understanding as the context, makes me very aware of the writer's question. What happens to a raisin in the sun? It does not always just shrivel. Sometimes it explodes with rage. When we ask, as we did in this survey, folks who live in the Finger Lakes region, adults in the Finger Lakes region, to provide us with a self-report of their mental health, they gave us answers of whether or not they saw their mental health as being excellent, very good, good, fair, or poor. And that self-reporting of health is recognized internationally as a very effective way of understanding the health of a population generally. And so when we ask that question here in the Finger Lakes, 90% of the adults who responded to our survey told us that their mental and emotional health was good, very good, or excellent. And I tell you, that's a Chamber of Commerce data point. That's something that we really want to celebrate. That 9 out of 10 folks who live here love living here and working and playing and praying in such a way as they can report that their mental and emotional wellness is excellent, good, or very good. But that means, my friends, that 10% of our neighbors tell us that their mental and emotional health is fair at best, or just simply poor. And if we just look at folks in our region who live in households with incomes less than $25,000 a year, that 10% more than doubles to 24%. And if we further isolate and just look at low-income households that are in unsafe neighborhoods, whether they're urban, suburban, or rural, now we're at 44% of adults reporting that they have fair or poor mental health. And this is why we called our report on the nexus of poverty and health overloaded. Because if you add transportation barriers to that, now you're at 54% of adults reporting poor or fair mental health. I tell you that we were able to ask interestingly open-ended questions. And one of the things that we explored was eating. And I find it utterly fascinating and reassuring that when we ask folks here in the Finger Lakes region, how important is it to you to eat healthy? We found across the income scale, no difference. Whether folks are rich or whether they're poor, everyone values eating healthy. What explains the difference? What explains the fact that just as honestly, folks in those lower income households told us, even though eating healthy is important, that they have at best fair, if not poor, eating habits. People know it. And they're honest about it. But what's interestingly fascinating is that when we look at the reasons why people don't eat healthier, for those at the higher income scale, Wade Norwood raises his hands and admits, my top reason for not eating healthy is time. And so my wife and I have the luxury of income, and we cheat with HelloFresh. And a box arrives at the door that gives us a meal that we can collaborate on getting onto the table in 20 minutes or less as our way of eating healthy while we're time crunched. Poor folk don't have that liberty. Eating healthy costs money. Eating healthy costs time. And transportation is a challenge. And you all know better than I that when folks sit and talk about the needs in the Finger Lakes region and they think transportation, there is a bias towards thinking the transportation problem is in Elmira and Rochester, for people who don't appreciate the distance gaps that exist and define reality in rural communities. I'll stop for a second and take questions, comments, or concerns before we start delving into the Wayne County specific data set. Anything you got there, Jay?
One question from earlier, Wade, was just when this data was collected.
This was data that was collected between Memorial Day and Labor Day in 2018. We spent until the April of 2019 doing the data analysis, and we have been disseminating broadly in the balance of 19 and 20. We are at work right now designing and tinkering with an updated instrument. I have to be very candid and say that I am highly skeptical. My staff calls me gloom and doom, but I am highly skeptical that we are going to be able to deploy My Health Survey 2.0 in the course of the summer of 2021. I think COVID is going to make that not workable. Our aim was to try and have an update to this data set, even though I still think it's fresh and current. I had wanted an update that we could connect to the 2020 census data so that we would be able to have fresh data and the community side to go with the census data for all of our collective planning work going forward. But I am far too sensitive to the fact that all of you all right now are COVID swamped. I don't think the situation is going to get much better. And I think asking everybody to take on a survey right now would be a sign of a desire to end a positive, mutually beneficial relationship. So stay tuned. Katie and Kathy will be in touch with you as we try and figure out the timeline for deployment of the next survey in the field and what that timeline will mean for getting refreshed data into your hands.
So got another question just on thoughts on the impact of the pandemic on this data. Are there any particular prognostications that you could make? And I do also want to let folks know that's exactly what we're going to be talking about a bit in the breakout discussions, is to take some of the thought from the room about where are we specifically in Wayne County. But Wade, any particular things that?
Absolutely. There are things, so I won't jump ahead of myself in terms of data that I'll present, but what I will say at this point is the mental and emotional health data. I think that were we looking at this right now, the picture would be even more bleak than presented. I have been very honest in my conversation since April, where I had to go 30 days without hugging people. I am a social creature. I draw energy from being in contact and in communion with others. The fact that this is now how I communicate, the fact that I have to engage in worship through Zoom, I know how profoundly my own sense of wellness has been impacted. So I think that if we were looking at data, we would see data across the socioeconomic ladder, and we would see a worsening among adults in those lower income brackets. And all of this data, I've been very clear on stressing, it's just the adult population. But as the parent of children who have lived in a household where there has been the death of their siblings, I can tell you that when adults are stressed and not doing well emotionally or mentally, the children suffer as the echo of that. And in fact, they suffer more because they lack the perspective that comes with having lived longer. And so I think this data masks a crisis of mental and emotional health among the children who live in the Finger Lakes region. And I think that has been exacerbated by COVID. And I am very, very worried about the long-term impacts of that. And so this is why I keep my regent's hat on all the time. And I'll say to you that as a member of the State Board of Regents, I am really barnstorming that parents and educators stop worrying about test scores and stop worrying about grades and college and all of that stuff. And let us be really focused on answering that question that comes from the tribal traditions of Africa that says that back in the days, the village elders awakened each morning and they went to bed each night with a convening focused on answering one simple question: how are the children? And right now, my friends, I am afraid that the children are not well. Thank you for those questions. Any others, Jay, before I jump back in?
No, keep right on going. I do want to make you and the audience aware that on the Wayne County page, we do have a data set. I want to thank Dr. Lustica and Margie Tabor from Wayne County Mental Health. There is a data set where we did ask that how are the children question to the children, and we did see exactly what you said, Wade. Children responding to the survey reported one level of concern of their own mental health. Adults responded with thinking that the children were doing better. And I think that many times children will act brave, will want to be supportive and will not want to further stress their family and, or for whatever other reason. But that data is available and it's right on our Wayne Partnership website. And it's really worth taking a look at that for everybody that's working with young people and everybody that has young people in their lives.
I would echo encouraging you all to do so if you haven't already done. It is one of the things that most impresses me about the partnership, that you all have novel data that others don't have. And it's because of how forward-leaning you all are in daring to ask the questions that other folks don't have the courage to ask. Because if you ask the question and get the answer, you're obligated to do something with it. And you guys have been phenomenal in terms of acting on the data. I cite the work you all have done around linking housing stability to educational performance as a real model of how health and education work together. I encourage you all to do so, and you please know that you enjoy my complete support because of conversations like you're having today. So let me say that in this vein of a picture being worth 1,000 words, let's go back to my favorite cartoon with the zoom in on Wayne County, which, as I said to you, I've been doing this for almost 15 years, and this reality captures people's attention very powerfully. And if we understand that health is determined by those upstream factors like income and education and housing, then what we begin to do is understand how incredibly important it is that we focus in on the real differences that exist within Wayne County itself. This is a look at income over the course of the last 18 years. And the income differential between Western and Eastern Wayne County is not only demonstrably pronounced, but it is widening. And that's the beauty of disaggregating data, because if you just look at the countywide trend, it would call your attention to the flattening of median income, where what we really need to be paying attention to is how much what's going on in Eastern Wayne County is a drag on what's happening overall. You all have far more insight into the why behind these numbers than I, but my hope is that as you all continue in conversation, this might be one of the areas that gain focus and attention for conversation and for collective action. I'm also struck as I look at the data set by the very poor. Those families that are living below 200% of the poverty level, and the differential in terms of the concentration of the very poor in Eastern Wayne as opposed to Western Wayne is also of concern. It's not just the fact that folks don't have income. It's the fact that we're talking about very, very poor people and that part of the county as well. This, going back to one of the questions that was raised, is a look at income in the course of COVID. And I saw this at a presentation that M&T Bank was providing and said, wow, this is stunning and really needs to be more widely shared. So I've started carrying it with me. I am waiting to get an update because this is data of our region's experience through August of 2020. But I hope that it is not lost on you that quite literally, in the face of COVID, the rich have gotten richer. And it's the poor folks who have suffered. And I think that we all know this intuitively because we know the places where those lower wage workers, those folks who can't do what I do, which is just put on my necktie, sit in front of my computer screen and keep doing my work and earning my income. Those folks who work in hospitality, in the restaurant, tourism, those folks don't have the liberties that I have. And not only have their wages sunk, but in too many cases, their wages have sunk because their employer has disappeared. And I think that that is a huge driver of not only some of the health challenges that we're going to see, but a lot of the social challenges that have wound up making the newspaper over the course of this pandemic. And then going back to the question of how are the children, you all know this, and I'm certain that you guys are going to touch on what's going on with your children, particularly in your districts that are serving the lower income students. Those students have had the school as a source of stability for their individual progress as well as their academic progress, and how that has been challenging for them is something that in both spheres of my life, we need to and will benefit from your sharing stories, data, and recommendations. My mantra through all of this has been that a crisis is a terrible thing to waste. Thankfully, we're finally seeing people begin to match rhetoric with money to support broadband in rural areas. If we don't have that solved by the time we come out of this, if we are not thinking about how do we really overcome the spatial challenges so that we can get more enriched course opportunities, more lifelong learning opportunities, more telehealth services, particularly in mental health, shame on us. Again, because of the fact that we had so many open-ended questions, we were able to really dig deeply into the why. And this is a look at why people told us they were not able to eat as healthy as they would desire, keeping in mind that we had the same level of population across income reporting the value of eating healthy. I would just call your eyes, and we'll make sure that all these slides get out to you all. But as we look at across these rows and columns to see where is the difference by income, the report that buying healthy food is too expensive. I can't tell you how many times I've heard wealthier people and more privileged people say to me, that's malarkey. People, it doesn't cost a lot to eat healthy. I am incredibly appreciative of Wegmans, and I don't know how many of you all are Wegman shoppers, but I'm a Wegman shopper, and I have noticed they're recognizing that moving towards the competition with the grocery clubs and the move towards bigger packaging works for people who have the privilege of deep freezers and disposable income. It doesn't work for poor people and for people who live in a trailer where there's not a basement for a deep freezer. And they have begun to move towards smaller packaging, smaller servings, I find it incredible now that my wife and I are empty nesters. All I really need is about a pound of meat, but I don't need it served in 1 pound. I like 2 half-pound portions of a pork chop or of a slice of chicken or of a slice of fish so that my wife and I can both eat. Food waste is spared with smaller packaging for my privilege, but smaller packaging sizes makes food affordable for families who can only afford to spend $3 on a meal to feed 4 people. And that's why mom winds up going to McDonald's, because with $3, she can feed a family. Maya Angelou said, when people show you who they are the first time, believe them. When low-income households are telling us food is too expensive, we need to believe them. That was a long way of my saying it makes me angry for people to discount the truth in people's lives. Food is expensive. We need to be working to make sure that we are solving for that problem. Keep in mind, these health disparities are costing us about $1 billion a year just in the Finger Lakes region. In terms of healthcare costs, lost productivity, and social services. It's in our interest to do something. The other thing I call your attention to is I don't have the transportation to go shopping for healthy food. The fact that 11% of folks in those low-income households are reporting that as their truth is something that needs to get our attention. And I am out shouting off the rooftop. That's not just Tynequa in the inner city. That's also Betty Jean out in the rural areas. Because the fact that there is this mythology that these challenges only exist in the inner cities, we have to do a better job, which is why this data is so important, because this is the region. This is outside of Monroe County. This is what allows us to make the argument for the investments that you all know need to be made. And my hope is that you'll continue to make us aware of where are the data gaps that you all would love to have filled to support your work so that we can turn our research and our data efforts in those directions. Equally interesting, looking at what are the self-reports that people tell us about the barriers to their being physically active. Can't exercise because of a physical limitation or disability really captures me. And I will tell you, I've asked my team, I want a deeper dive into that data point. We've got enough data just out of this iteration for about 3 years worth of work, which is frustrating my team because of the fact that they know that there's more to learn, but they also need to get the survey updated. But we did a look at the health of women in the region maybe about 7 years ago. And one of the things that was incredibly striking among women who live in low-income households was the amount of pain that they report. And what struck me was how true it is that the most back-breaking labor in our community today is no longer done by men at the end of a pitchfork or a shovel on a road or a construction project. The most back-breaking labor in our community today is most likely done by a woman in a healthcare setting. And as a result, not only do we have high rates of such women on disability, but we have this truth that their physical well-being is limited because of their disability. And there's a lot of work to be done at that space. Transportation again shows up here as a barrier to physical activity. I'm going to move towards my conclusion, but I will share with you that our job was to not only be helped by, but to also be of help to you all and your county health department. And so at your request, we included questions where we asked folks to tell us what are their biggest fears for themselves and for those that they love, and what do they think should be the priorities set for Wayne County for adults and for children. And as you can see by this slide, the cost of care, weight, and mental health wound up really topping the responses to all 4 of those questions. The good news is that those comments really align well with the novel, promising approaches you guys have developed. So I think that you should feel incredibly good about the fact that our data really affirms and confirms that you all are innovating in all the right places, that you all are being directly responsive to the folks with whom you partner and the folks whom you serve, and that your work is directly responsive to the fears that people are expressing. But those fears really point to huge system transformation needs, particularly around access. And I have to admit that I am very frightened about what the impact of COVID is going to have proven to be on those points of access. As you all know, I have been asked by the Monroe County Executive, with the support of our local health departments, that Common Ground Health take a leadership role with regard to the COVID-19 vaccination process. No good deed goes unpunished. So this has been my punishment. And since December, we have been working to stand up the task force and to orient it towards its work. And I am happy to report that Diane, as she convalesces, Reverend Green, Carrie Van Auken on behalf of Diane, and Vicky Ramos from the BOCES have all agreed and have begun serving as members of the vaccine task force. So Wayne County is incredibly well represented in these conversations. And I, with the same level of attention and intentionality, have ensured that every county has such robust and diverse representation on the task force. And we also are the conveners, as you all should know, of the Regional Reopening Schools Safely Task Force, on which Jay and Vicky have both served. And I am incredibly and everlastingly grateful to them for that service, because I think that this schools task force has played a pivotal role in making sure that our needs and the needs of our students have not been overlooked in the process of figuring out how we maintain educational services in the middle of an unprecedented global pandemic. So I would say to you, my friends, that after a brutal and challenging 2020 that brought us an experience very much akin to that which we were experiencing as a nation a century ago. That we stand at the start of a new year. And in that new year, I stand filled with hope. And I have hope not just because of the incredible brilliance and joy and strength of the children in the Finger Lakes, but I have hope because of you all. So thank you very much. I have left myself 10 minutes to be able to respond to any additional questions or comments that you might have. Then I'll come back with closing comments and get off the stage on schedule. Jay, any questions from the field?
Think in general, more comments and wondering around, some wondering around what benefits there are for education around cooking meals. If some additional education in that regard would be a help. We had one question asked by June specifically about some data, and Kathy put an answer to that in a direct message to me that I can get out. So right now we are pretty open for questions with the general take. If you wanted to start, Wade, just on what capacity building for families can we do for families that are living in poverty, given no change in resource? Is there anything we can do to help people use the resources they do have to be more healthy?
I will preface my response to that by saying, thank God Kathy is on the call. I am delighted to be supported by my incredibly talented staff, and I want to thank you all for the gracious courtesy that you extend to my colleagues each time they interface with you. It is deeply appreciated. I think that the opportunity that we have is to really focus in on how essential basic life skills truly are to being able to function in times like this. I have been incredibly impressed with my 30-year-older and my 22-year-older in that what they have demonstrated in the course of the last 10 months is adaptability and problem solving. They both have spent this pandemic out in California, and their resourceful adaptations has to me been the hallmark of their education. And I would really ask you all to be mindful of the fact that the Board of Regents is publicly committed by December of 2021 to create policy that articulates what does it mean and what should it take to earn a high school diploma in the state of New York. Right now, the answer to that question is a course and credit distribution that meets certain guidelines and pass a certain number of Regents exams or the equivalents of Regents exams. And that's how you get a diploma. I truly think that having a high school diploma should mean that you have certain capabilities. My mother was adamant we would not leave her home without knowing how to cook, without knowing how to wash clothes, without knowing how to sew and mend clothing, without knowing how to keep a house clean, balance a checkbook. There were basic competencies that my mother demanded we all have. And she and our school district ensured that we would meet those demands by the fact that I had to take wood shop and metal shop, just as I had to take home economics. Even though college bound, those things, personal typing was probably the most important course I took in high school, because I know how to 10-finger touch type. And spending most of my life working on a keyboard, that's the most incredibly valuable skill I've learned. I think that we have to be, as a community, and I would really implore you all to start talking about the fact that no high schooler should graduate without knowing how to shop for, budget for, prepare, and serve a healthy meal. That teenagers ought to understand the food that you put in your body is going to impact your health when you're in your 30s, 40s, 50s, and 60s. Young people have a sense of invulnerability, but they also should have a sense of inevitability. I just gifted a child in my circle with a copy of Aesop's Fables, because I think that those old verities are still true today. I think that they are civic religion, and I think that they are a way in which we can impress morals. The story of the ant and the grasshopper is an essential story to understand that while you can, one should use good times to prepare for bad times. Those are the types of things I would really implore more community voice in helping us rescue education so that we stop adulterating childhood.
Still open for questions. If anybody has any questions, I know it's a lot of data and there's a lot of information. But I also want to encourage you that I've always seen Wade be able to respond to every question, and I wouldn't be afraid to ask him anything at all. So please,
Please do not be. Nothing's off limits.
We have probably time for 2, maybe 3 questions, depending on their length.
That means I've done such a brilliant job. I predicted every question and answered it.
I think I just, I guess my question, Wade, would just then be, as your staff has been wanting to continue to learn about the data, and as you cut out maybe some things to make time for this presentation, to make the presentation fit the time we had, what are some other interesting things you've learned in review of that data, or in general discussion with folks about the data as you presented across the area?
I would say the 2 other things that have stood out to me from the data, starting with this thing about mental health and the incredible importance of addressing mental health issues. I'd say the other is aging and how much the data, going back to this comment I just made about children, when we asked people overall with regard to health issues, health concerns by income, wealthier families report thinking about aging and long-term care issues. Those issues don't show up among our lower income respondents. It really is like, oh my God, I'm in freshman year of college and it's Maslow and his hierarchy of needs. It really shows, and I do remember in a political science course reading Banfield's The Unheavenly City and being offended of this description of at lower incomes, folks are very present oriented, because the fact that Banfield didn't talk about why. And the simple truth is, if you don't have the luxury of thinking about tomorrow because you're trying to figure out where you're going to sleep tonight, it is rational to be present oriented. And I think that the failure that we have as a overall community to understand the context of people's lives is one of our major barriers to making progress. That when Mrs. Jones shows up 15 minutes late for her appointment, maybe she ought to get a frickin' standing ovation, because she probably jumped through a month's worth of the problems that I have to get there today, as opposed to the easy life that I have of I just walk out, put my key in the ignition, and I get wherever I want to go. And so I think it's that lack of knowledge and appreciation for each other's lived experiences. And I think that would then go to my third comment, which is my bigger regional worry, is how well do we know each other? When I grew up in the inner city, southwest neighborhoods of Rochester, I worshiped in rows. And so we would get up very early on Sunday morning. My mom would load us in the car. We'd pick up my aunt and her children, my cousins, and we'd carpool out to Rose. We'd have service. If there were an afternoon service or an evening service, we'd have lunch, dinner out there, and then go to church. If we didn't, then we would go to Sodas Point, and we would play on the beach in the sun, and then come home. There was not a sense that Rochester and Wayne County were separate communities. They were part of our community. And I am scared that that is no longer the case, and hasn't been the case for 2 generations now. How is it that we can reconnect ourselves with each other and recognize that we are all one community? I think what you guys do is a huge part of that, because you have been standing in the breach to demand that Wayne County is one county and not allow this tale of 2 cities to become a tale of 2 different communities. I think we need to do that regionally. And I think if we did that regionally, it would help us know about each other and be more sensitive to each other. And I think if we demonstrated caring and sensitivity, we'd actually get at the mental and emotional health needs. And I'm confident that once we deal with the inner self, all of the outer issues are easily soluble. But this is about the heart, and the heart can only be affected through the power of love and the incredible attention that's called kindness.
Wade, thank you so much, and really appreciate your time. And you ended on the button. And just thank you again. I know that people will be looking for this presentation. The recording will be available on the waynepartnership.org website. If I ask David to hurry, probably by tomorrow morning, maybe even by this evening, if I tell him to work into the night, but if he's able. I don't know if his cat will agree, if that'll be okay or not. But we really, really appreciate the partnership with Common Ground Health. I would invite people this is a great time also to talk about the Wayne Health Improvement Partnership. It meets on Fridays. You'll notice that we focus on education, on family supports, and on behavioral health. We don't have a health focus in the partnership because public health has a table for that. So we don't duplicate tables. We don't want to divide people. We want to bring people together. And I do see Diane Devlin on the call. And if she's comfortable, I'd like to ask her to come off of mute. And one, could we get a round of applause or for Wade first, or
Great, thank you very much.
other-
Thanks, Wade.
and then also just for Diane Devlin too, and for public health and all their tremendous frontline work that they are doing to try and keep us safe and now to get us vaccinated. And Diane, just you've been a key part of getting Wade to present, to invite Wade out, and you've been hyper focused on poverty. You've been a real champion for our communities for so long, and I just want to acknowledge that. Diane is absolutely the driving force for this work at the Wayne County Coordinating Council and at the partnership.
Amen.
And Diane, I just want to give you a moment. If you wanted to say anything before we go to break, we'll let you be. I'll let you share something. I'll do a little bit of housekeeping, and then we will do a break. Wade.
Okay. Can you hear me?
Yep.
Okay. Thanks for allowing me to speak. I've been out of work for the past few weeks because I had to have a last minute surgery. So if you haven't seen me around, that's why. So yesterday I came back and I realized, oh dear, tomorrow's the Poverty Summit. So yeah, this has been a project I've been trying to get spearheaded, and I'm very grateful that Kathy McGonigal and Jay Ruskup has taken the reins to get this actually to happen. We were going to have a very large summit this past summer, and unfortunately COVID decided to take over. So I have been noticing since I became the director 11 years ago that the very divisive line between east and west in our county for socioeconomic status is slowly moving westward. When I first started, you would have a stark lower socioeconomic in the east half from pretty much Sodus and Lyons eastward, and then the socioeconomic status in the western half was very at a very low level. Now we're seeing the socioeconomic status in the western half starting to become more lower and lower than what it was when I first started. So when we got the My Health Story survey completed, and then when Common Ground Health completed their overloaded report, it just brought it home even further, especially when you can see that if you live in the far eastern part of the county compared to the western part of the county, you could have anywhere from 6 to 9 years of life loss comparatively. So there's a lot of work to be done. Unfortunately, it takes a mountain to move this needle on poverty. And I am very grateful that this county is very collaborative. I've said that across any avenue that I can go to. We are very blessed in this county. When I go to state conferences and stuff, there are many local health departments that say that they can't get into the school districts. The school districts do not welcome them into their home. I'm very blessed that whenever I need to, I can call any superintendent and off I go into a school district to do what we need to do. But you know, Jay's been very instrumental with his community schools initiative to get different things off the ground, and even just to educate the community in regards to what is occurring, what is needed, and that I'm very thankful for. And he's been doing a tremendous amount of work. In regards to the land of COVID, we've been working extremely hard trying to do case investigations. Our numbers have skyrocketed. Just to give you a comparative, on October 1st, we had 308 positive cases. As of this morning, we have 3,118 cases. So that's how much it's gone up in just 3 months. So I encourage everybody to be safe, to wear your masks, wash your hands, try to social distance as much as possible. Most of our cases are coming out of small gatherings where families have gathered for either Thanksgiving, Christmas, and New Year's. We understand people are COVID tired and they are wanting to gather with their loved ones, especially over the holidays. But if you could try to sustain that until we can get some vaccines in everybody's arms. That would be most helpful. We are starting our clinics. Yesterday, we held a clinic for 6 hours and we vaccinated 581 people. My team did an awesome job because we did have a glitch with our system breaking down, our computer system, and we switched to paper quickly. And I really appreciate those who were in line to get shots because they were very understanding and willing to wait to get their shots. So be patient. We'll get out eventually to all of you all when we're able, and soon we'll be starting with school shots. But again, I thank you, Wade, for partnering with us and being willing to discuss poverty and the knowledge that you have in regards to urban versus rural. I really appreciate Common Ground Health. When I first started this job, there was very little presence in the rural community, and you have taken a very big step to moving it to more rural, and even your predecessor. So we really welcome that in the Finger Lakes rural counties, having Common Ground's knowledge and assistance with different projects. So I look forward to working a lot more with you guys on different projects. I've already got a few ideas and had a few conversations with a few in regards to doing some health literacy in the community, especially those in the minority group, so that we can get them up to snuff on that so they understand what they're discussing with their physicians and stuff. And again, just Wayne Health Improvement Partnership is a group of individuals that are health and human services. Schools are welcome to come to the table. So if anyone is interested in joining that group, send me a note to Jay. They can get your information to me, and we can invite you to come. Unfortunately, since COVID has happened and Wayne County Public Health is the facilitators of that partnership, we've had to cancel a lot of meetings. And because of social distancing, it's very hard to get out in the community to do community health improvement partners or planning activities because, you know, we're trying to social distance. So, but hopefully we'll get back to that soon. But anybody's welcome to the table, and it is held on the third Friday of every month at 9 a.m. And right now it is via Zoom, but I can tell you it's not going to happen here in January because we are just so busy trying to do case investigations. So bear with us, we'll get back to it. But anyways, I think that's all I have to say. I'm sorry if I took too long.
Oh, you did not, Diane. You can't take too long. You're a champion. We appreciate hearing from you. Wade, again, want to thank you. And I'm going to head into some basic housekeeping. And I don't know if you're welcome to go when you want to go, or if you want to. Thank you.
Thank you all very much. Great to see you again, Diane.
So for everyone else, I just want to draw your attention to the Wayne County Partnership website again. This is the summit. If you go up here under resources, top tab, okay, so you'll see Poverty Summit. It brings you to here. The Zoom link, which, you know, if you get kicked off and you're like, where's that link? Here it is. If you couldn't complete the registration form before, or just to let us know you are here, that'd be great. So we know who you can click right there and fill that survey out for us. The agenda there. And this is the part that Wade's slide deck is already up. Okay. So Wade's slide deck is already up if you need that. The discussion sheet. This is what we're going to come back to. So I just want to take a second to go over this, and then we're going to go on a 10-minute break and we'll bring people back. So you'll be able to pull this right up on the website. But the directions for breakout sessions is try and get yourself in order, right? So there'll be a facilitator. You need basically to do 2 jobs when you get into the breakout room. We need somebody to volunteer to facilitate, and that, you know, the roles are right there. And we need just to decide a move order. Like right now on the Zoom screen, everybody's probably in different order. So I would just like to, you know, ask everybody when you get into a breakout session to either rename yourself, or if it's a small enough group, just kind of know what the batting order is, so to speak, so that then you can go around and do a quick icebreaker, which is sharing your name and one place that you'd like to visit that's a fictional world. My daughter, for instance, might want to go to Hogwarts if she was sharing that out. And then so far today, what's one idea that's sticking with you? You should be able to pick your breakout sessions when you come back, and you'll be able to focus either on empathy, on the concept of scarcity, on the concept of opportunity, we're in a crisis, don't waste a crisis, or on the concept of equity. Those groups, these are guiding questions. These are designed to spark conversation. They are not designed to limit the scope of your discussion. And the facilitator can just help make sure that everyone gets a chance to speak. Some bonus roles there, if anybody really likes to do some research, or anybody really wants to help make sure that we get the notes out of your group, that would be great. I'm hoping that note takers could perhaps send me your notes from the breakout sessions. So when we come back from break, I'll go over that one more time real quick, and then we'll put people into breakout sessions, and we'll spend the remainder of the time really in breakout. And would really like to push on the idea. I know it's great to listen to Wade. What are we going to do with all that wonderful stuff he told us? So come back, I'll give you a little more information just on the impact of youth specifically. I'll go over the breakout pieces again, and really want you to be aware that we are going to be asking you, what do you think? What needs to be done? And it's from conversations like that that we got ideas like the Career Carnival, the Youth Leadership Forum, that we piloted different components in different schools and places that have led to a real difference. So for those of you that come back, the first thing you're going to get is a quick 10, 15 minute youth data piece for me, and then some breakout sessions. And that'll take us through the summit, which will wrap up around noon. Can I